Hi, everyone, and welcome. We'll get started promptly at 2:30 Eastern. While folks are joining, we would love if you would introduce yourself in the chat. So please feel free to share your name, your organization, and where you're joining us from today. Hi, everyone, welcome. We're going to get started in about 2 minutes. But for those of you who are just joining us, if you want to introduce yourself with your name, your organization, and where you're joining us from today, that would be great. Hi, welcome everyone. We have a really great conversation today. Looking forward to sharing a lot of innovation and partnerships. Before we get started in about a minute, we would love for you to introduce yourself. So please feel free to put your name, your organization, and where you're joining us today from in the chat. Hi, everyone, and welcome. We're going to get started in about 30 seconds. For those of you who've just joined us, please feel free to introduce yourself with your name, your organization, and where you're joining us today from. Okay, well, we just hit 2:30. So welcome to the Housing and Services Resource Center's webinar, Accelerating Housing and Services Partnerships to Advance Housing Stability, Centers for Independent Living. We're honored that all of you have chosen to join us. This is the third and final webinar in our webinar series on the Housing and Services Partnership Accelerator, Emerging Findings for Strengthening Housing, Health, and Social Care Partnerships. Next slide, please. My name is Ryan Elza, and I am the Interagency Housing Innovation and Strategy Lead at the Office of Interagency Innovation at ACL, and I'll be your facilitator today. Next slide, please. First, a few housekeeping notes. Please use your computer speakers or dial in using the phone number in your registration email. Please note that all participants are muted, and please feel free to actively use the chat through the webinar to make comments or connect with other participants. To ask a question that might be answered during the question and answer section, please use the Q&A function on Zoom. This will allow presenters to easily find your questions, and you can also send your questions or comments via email to hsrc@acl.hhs.gov. Someone will be monitoring the HSRC inbox throughout the webinar. And please note that this event is being recorded, and by staying to participate, you are agreeing to participate in the recording. Next slide, please. And a few notes on accessibility. We will have ASL interpreters pinned throughout the webinar. To enlarge the view of the interpreter, you can click on their window and select the pin icon to maximize your view. For screen readers, if you would like to reduce unwanted chatter, you can request speech on demand by hitting the Insert key, spacebar, and the letter S on your keyboard. Next slide. First, we wanted to get started by getting to know you a little bit, our audience and participants. So we have a poll question that should be launched right now. And we want to know, what is your primary sector? Your options for response are Medicaid, health, healthcare, non-Medicaid, housing, homeless, disability and or aging, human, social services, not included in the above, community development, association, advocacy, philanthropic, education or research, consumer, and other. And we will check on the results in a little bit. Next slide, please. In case we have participants who have not yet heard about the Housing and Services Resource Center, the HSRC was launched by the U.S. Departments of Health and Human Services and Housing and Urban Development in 2021. The HSRC fosters cross-sector partnerships between the organizations and systems that provide housing resources and homelessness services, healthcare and mental health services, independent living services, and other supportive services. The HSRC is part of an interagency initiative to streamline and expand access to affordable, accessible housing and the critical services that make community living possible. Next slide, please. On this slide, you'll see here a map of the US with the states that were a part of the Housing and Services Partnership Accelerator, or HSPA, highlighted in blue. The goal of the Housing and Services Partnership Accelerator is to support states and communities to accelerate the development and implementation of innovative state strategies through Medicaid demonstrations to provide housing-related activities and supports to persons with disabilities and/or older adults who are at risk of or experiencing homelessness. Through a competitive process, 8 states, Arizona, California, Hawaii, Maryland, Massachusetts, Minnesota, and North Carolina, and Washington, and the District of Columbia were selected to participate in the year-long accelerator. Next slide, please. The accelerator, federal partners, and the participating states know that the coordination of housing, assistance, and wraparound supportive services is a proven cost-effective approach to assisting older adults and people with disabilities and individuals with chronic and complex health conditions to transition from homelessness, exit or avoid institutional settings, and live in the community. This illustration provides a high-level sense of how housing, health, and social care partnerships can support older adults, people with disabilities exiting homelessness. To orient you so you can look at it more closely at the webinar, we have a top arrow that shows the Medicaid, health, and housing social care funding streams and services that can be braided together. As you can see, the ACL network, which includes Centers for Independent Living supported under the Rehabilitation Act of 1973, as amended, provides funding for outreach, supplemental services, and home and community-based services. To have the most impact, supports funded by these streams deliberately coordinated so that people, as they journey from homelessness to housing stability, get a seamless set of supports. And at the bottom, the lines are dashed because a mix of supportive services should be responsive to individuals' preferences, needs, and the mix of assistance that would change as the individual situation changes. Today, you're going to hear how Centers for Independent Living fit in this equation and the services and unique perspective they can offer. Next slide, please. And here are some types of housing-related supports that states are covering through 1115 demonstrations and 1959 state plan amendments for Medicaid-eligible individuals of older adults and people at risk for experiencing homelessness. With RTA, we're helping define solutions to the challenges and how to operationalize these supports. So we have a graphic of a brain with a little heart in it that highlights other supportive services. We have a magnifying glass that is focused on image of a house and shows pre-tenancy services that include transition and navigation services. We have a paper icon with a home that shows tenancy sustaining services, including individualized case management. We have a house with a wrench that is attached to home remediation. And then we have a house with the icon of an active individual in a wheelchair to show home and environmental accessibility modifications. Next slide. Now let's look at the poll results to see who we have in the audience today. So we have 8% who are folks who are with us today from Medicaid. We have 2% from health and healthcare non-Medicaid. We have 33% of the audience from housing and homeless. We have 35% of the audience from disability and/or aging, and we have 10% from human and social services that are not included in the above responses, 2% from community development, and 2% from association, advocacy, philanthropic, education, or research. And with that, let's go to the next slide. We're happy to have all of you in such a cross-sector representation. Here's our agenda today. We've already gone through our welcome. And next we'll have an overview of Centers for Independent Living. Then we'll get examples of independent living network partnerships. We'll hear a perspective from a CIL, and a partner organization. And then we'll open it up for Q&A. And as a reminder, please drop your questions using the Q&A function. Then we'll have a few concluding remarks. And with that, next slide. I want to introduce our first speaker of the day, Mary Kate Wells, Director of Programs for the National Council on Independent Living, or NCIL. And with that, Mary Kate, take it away.
Awesome. Thank you so much, Ryan. Hello, everyone. I'm very excited to be here with you all today. My name is Mary Kate Wells. I'm the Director of Programs at the National Council on Independent Living, or NCIL, NCIL. For a quick visual description, I'm a white female with short reddish hair wearing a purple and green sweater. So the National Council on Independent Living, we've been working with the Housing and Services Resource Center, but NCIL is the longest running national cross-disability grassroots organization run by and for people with disabilities. NCIL's mission is to advance the independent living and the rights of people with disabilities. We do that through a national advocacy agenda, building the capacity of the IL, or Independent Living Network, and our membership. Today, I'm going to share a little bit about the Independent Living Network and how CILs have been a driver for community living since its inception. And then welcome our presenters who are going to provide examples of these partnerships. Next slide. First, I'm so excited to see a lot of folks from centers in the chat, and as well as other partners. So some of this information is directed to our hopefully new partners. So the Independent Living Network, for big picture, is use a graphic on the screen with 3 boxes to describe the local, state, and federal levels. In a simplified explanation at the local level, we have Centers for Independent Living, or CILs, CILs, and people with disabilities that we sometimes call consumers. At the state level, we have the statewide independent living councils, or SILCs, if you hear that acronym, SILC. And then at the federal level, we have the Independent Living Program, which is administered by the Administration on Community Living, or ACL. Next slide. So Centers for Independent Living, some key things to highlight here. So centers are community-based, cross-disability, nonprofit organizations that are designed by and for people with disabilities. most CILs receive federal funding authorized, as Ryan said, in the Rehabilitation Act of 1973 as amended. CILs are unique in that they operate according to a strict philosophy of consumer control. And what does that mean? That means that people of all types of disabilities directly govern, make decisions, and staff centers for independent living. Some other common funding sources are federal, state, and city disability and aging funding. Some centers for independent living receive funding from Medicaid or other healthcare contracts, as well as assistive technology. There is a Center for Independent Living in all states and territories, and there's over 400 across the country. Next slide. CILs are a hub for disability information, resources, services, and advocacy. So what you'll find, all CILs across the country are required to provide 5 core services. That includes peer support, information and referral, individual and systems advocacy, independent living skills training, and transition either through diversion from a nursing home or coming out of, say, a nursing home or other institution, as well as youth transition. Some examples of how those core services are translated into the housing and services area is many CILs, have housing search workshops or trainings, home modification programs, assistive technology loan programs. Many CILs that we'll hear today support people with disabilities get personal care assistance, individual advocacy with landlords or for fair housing complaints, and then nursing home transition and diversion. Something I will just quickly note here is that each CIL is required to provide these 5 core services, but it's going to look different community to community because the services that and programs they provide need to represent their community. So next slide. The statewide independent living councils develop the State Plan for Independent Living, or SPIL, and they support coordination of activities with other disability agencies within the state. I'm not going to go too much into it, but we're going to hear shortly a little bit more about the SILC's role in housing from one of our presenters. So next slide. So for folks joining that maybe are from Medicaid agencies or other network agencies, wanted just to highlight how Medicaid, how CILs can support Medicaid housing and support services through this lens, right? And I've mentioned a few: housing search process, home modifications and assistive technology, personal care assistance, and then nursing home transition. And next slide. So before we get to our presenters, just some, and I'm going to pause until our other ASL interpreters pinned. Awesome. Some considerations for working with CILs and SILCs. These are just a few, but I always say, like, going into these relationships and partnerships with a common goal. So for example, community living is a shared goal, among a lot of Medicaid programs, but also centers, right? And I would just recommend starting a conversation with your local CIL, acknowledging and learning that there's difference in language that we use between networks and different approaches. But there's an opportunity to learn what is already happening in the community and gaps or other supports that are available that the two networks can work together. And then finally, just keeping in mind that develop solutions that are led by the people they affect. So Centers for Independent Living and the independent living movement is disability led. So really encouraging on the state level or systems level, really utilizing the existing network of centers to really support that disability led and involving folks with lived experience. If you want to find your local center for independent living, there's a link on the slides in the material at ACL. That's Part C centers, but Nicole will be having a member CIL map shortly, so that will be available. So with that, I am going to hand it off to our first presenter, Gloria Garton, Executive Director of the North Carolina Statewide Independent Living Council, to give us the first example of partnerships in the IL network.
Hi, everyone. As Mary Kate mentioned, I'm the Executive Director of the North Carolina Statewide Independent Living Council, and also a former Center Director here in North Carolina. A visual description: I'm a Caucasian female with blonde hair, and I'm wearing glasses. And am excited to be here today and talk to you about how statewide independent living councils can have an important role in addressing affordable and accessible housing. Um, Statewide independent living councils do not provide direct services, so our role is to work jointly with centers for independent living in our state to develop our priorities for a 3-year state plan for independent living, often referred to as a SPIL, SPIL. And in North Carolina, our state plan for independent living is developed through needs assessments, focus groups, individual interviews with consumers, looking at the um, annual performance reports from the Centers for Independent Living that share their information with us. And based on all of that information, we are fairly easy able to determine what some of the most pressing needs are in our state that the statewide independent living council can work on to create systems change, support our centers for independent living. And in North Carolina, we have only we don't even have half of our counties covered or have access to a center for independent living. We have 100 counties and only 40 have access to a center. So our role also becomes for organizations and other housing partners that are looking to connect their consumers um, to resources that don't have a SIL in their county. We try to help direct them to other resources by providing some information and referral. Um, but in our state, we have the Healthy Opportunities Pilot Program, and one of our centers is participating in that program. That is the Wilmington, North Carolina Disability Resource Center. And that program has been so helpful to connect people with disabilities who are eligible for Medicaid to participate in all of the services that are available through the Healthy Opportunities Pilot Program, which mostly helps people be able to find housing and live independently in their homes. So from the SILC perspective, um, we would love to see that program expand across the state of North Carolina. We also know how valuable centers for independent living are, and we do not want them to continue to be the best kept secret. We want people to know about centers for independent living and all of the great resources that are available to them. So one of the ways we decided to make that happen is we have an executive order for our statewide independent living council that we have modified that will require the governor to appoint somebody on our council that works in the housing sector on a statewide advocacy basis to be on the council and to work with the Centers for Independent Living in hopes that they will be more in tune and aware of the barriers that continue to address people being able to stay independent in their homes, and more importantly, helping people transition back into their homes. So that was one of the first things our SPIL addresses is the appointment to that key position on our statewide independent living council, and also intentional partnerships. We went through a long list of people providing housing services to identify which groups don't know about centers for independent living and the roles that they have in helping people living independently. And then the last goal in our state plan is for all of us, the centers and the statewide independent living council, to come together and create what is called an inclusive housing toolkit, which will live on our webpage, and also the centers can share it on their website as well, in plain language, to hopefully help individuals that are looking for housing that is affordable and accessible, or maybe needs home modifications, to access the resources they need to self-advocate for housing. And we will also be hosting in the next 3 years on an annual basis, some housing forums to continue to collect information to share with our policy partners here in North Carolina about what is still needed for change, and to provide education opportunities for consumers to learn about the Centers for Independent Living and how they can help people with disabilities find housing. So if you are not familiar with your statewide independent living council, I believe, yes, Mary Kate put that link in the website. You can also just Google statewide independent living council, and then you should be able to, for your state, and it should easily pull up that information for you. So that is, I will take questions, I guess, at the end. And then I'll turn it over to our next panelist.
Thank you so much, Gloria. This is Anna Acton. I'm the Deputy Director for Independent Living and Community Access Division at the California Department of Rehabilitation. I also was a former Center for Independent Living Executive Director and have really worked a lot in this area of independent living. So the California Department of Rehabilitation is the designated state entity in California that works in partnership with the State Independent Living Council in California and administers funding for the state plan for independent living to meet the goals and objectives in our California State Plan for Independent Living. We work very closely with the Centers for Independent Living in California, which we call Independent Living Centers. So California, I want to go over a little bit about how we became involved with our Housing Services Partnership Accelerator. So California was selected for the Housing and Services Partnership Accelerator really to support developing and expanding innovating housing-related supports and services for Medicaid-eligible individuals with disabilities and older adults who are experiencing or at risk of homelessness. California was really excited about this opportunity to really take advantage of a cross-department initiative and to engage with managed care, public housing authorities, housing providers, the homeless response system, and disability and aging networks. So DOR, as the Department of Rehabilitation, we're the vocational rehabilitation program for the state of California, but also house the independent living centers where we provide support. We really engaged from the beginning, along with our Health and Human Services Agency, our Medicaid agency, our housing agency, and the Department of Aging. From the beginning of our application process, we wrote in the intention of working with our area agencies on aging and their association, the Independent Living Centers, or CILs, and their membership association, as well as a host of housing and homeless service providers. We built our application for Housing and Services Partnership Accelerator based on California's Master Plan on Aging, which includes at its first of 5 key goals, housing for all stages and ages. We also built into the application our state plan for independent living and our intention to work within the framework of the state plan for independent living, which provides, for the delivery of independent living services throughout California. Some of our goals with working together as the state departments, across state departments from the beginning, was to really deepen and expand our cross-sector partnership at the state and local levels to better leverage collective resources to meet the health and housing needs of older adults and individuals with disabilities at risk of or currently experiencing homelessness. It was our hope to expand our cross-agency partnership in a way that we would work both at that state and local level, but locally with our continuums of care, our public housing authorities, those housing providers, and the Aging and Disability Network. We also wanted to increase our understanding of unmet housing and service needs and identify opportunities to really better align health and housing services, both state and locally. The California Housing Related Community Supports Advisory Committee was one of the initiatives that we leveraged. It's a statewide group of housing and homeless community support service providers, both Medi-Cal, Medicaid managed care plans, public housing authorities, behavioral health departments. And we brought some of the independent living centers. Keith was one of them that I'm going to introduce in a minute, to engage with this advisory group that was really working on providing recommendations to the state on how we can improve housing related services for the Medicaid population here in California. So in California, I want to give you just a little bit of a look of what it looks like in California for the Centers for Independent Living or independent living centers. So we support here at the Department of Rehabilitation and through our state plan for independent living, 28 centers for independent living throughout the state that provide direct services and advocacy to ensure people with disabilities have access to social and economic independence, including housing services. In California, we have a state core service of housing for our independent living centers. Currently, we have 12 of the 28 independent living centers contracted with managed care plans to provide those housing supportive services funded through Medicaid. We have many working with our housing providers and regional housing authorities to support access to affordable and accessible housing. Majority are working with their homeless continuums of care, homeless response system through informal partnerships. We have a handful of them working with our continuums of care, homeless response system through formal partnerships, including by entering their data and coordinating services through the homeless management information system. 27 of the 28 independent living centers in California are a core partner along with the Area Agency on Aging for Aging and Disability Resource Connection, really streamlining access to a wide range of services for people with disabilities and older adults in California. So as part of this initiative, we put together a paper, we did a webinar, really helping to connect the disability network with the homeless response system, both for our independent living centers and for our vocational rehabilitation program in California, because we really do see employment as well as a path out of homelessness. So some of the things we have talked to our independent living centers about and we're seeing them do is really leveraging their expertise and really understanding how to best serve people with the most significant disabilities and really mobilizing resources on the local level. They're participating in the point of time counts. They're attending their continuum of care boards. They're supporting their homeless and housing system to better understand the needs of people with disabilities. And they're also leveraging homeless dollars and funding. They're building those relationships at the local level that really allow them to build the capacity of the homeless response system to better serve people with disabilities. In California, almost 50%, half of all the homeless individuals here are individuals with disabilities. So this is an issue for all of us to address collectively and bring our shared expertise and resources together to really meet the needs of the community. And so with that, I want to introduce Keith to come up next and talk about the work that they're doing as a Center for Independent Living Center here in California in downtown Los Angeles County, and to share with you the work that they're doing with individuals with disabilities who are homeless or at risk of homelessness. Welcome, Keith.
Thank you, Anna. Thank you very much, and thank you for having me. So my name is Keith Miller. I'm the Executive Director for CalLife, Communities Actively Living Independently and Free, located in California, but in downtown Los Angeles. So we see a lot here. So we have a short window, but CalLife provides a lot of different services here. So we're going to touch upon just a few of them. And one of them is housing rights. So under housing at CalLife, we do housing advocacy, fair housing, and tenant rights. So at CalLife, we work with individuals with disabilities and seniors. Through our housing department, we provide advocacy when individuals experience discrimination. We do this by providing direct services or making referrals to outside agencies. If we cannot resolve the problem internally and it doesn't fall under the ADA, the American Disability Act, we contact Fair Housing under the U.S. Department of Urban Development. Under Fair Housing, individuals can file a complaint if a landlord refuses to rent based on race, color, national origin, sex, or disability. CalLife will guide the individual through the filing process and provide ongoing support to help resolve the issues. And often people with disabilities are discriminated based on the fact of the perception of a landlord, or if someone has a service animal. So we really do our best to sort of guide them through that, so if they're experiencing some level of homelessness or losing their housing based on some level of discrimination, we try to walk them through it and get them to the right connections and provide the service necessary so they don't end up living in a situation that they don't choose to be in. And with that, I'm going to introduce Megan, who's going to be talking about what we do for landlord engagement and canvassing for housing. So Megan. Oh.
Hello, everyone. How you all doing? So as Keith said, I'm a housing advocate here in CalLife in downtown LA. And as a housing advocate, I'm working to help our clients with disabilities understand and advocate for their rights to affordable and accessible housing. Whether the person has a disability, they're experiencing homelessness, they may be exiting or avoiding an institution. Whatever the case may be, our goal remains the same. It's to assist the person in finding housing stability. In regards to landlord engagement, we work to build relationships with property managers to secure housing for tenants. For example, the Hayward Manor Apartments in downtown LA is a complex that we built rapport with as an agency and have been able to maintain a relationship with over several years. So many of our clients who have walked through our doors are now housed there at the Hayward. So there's some methods of canvassing that we have found helpful, such as identifying the property managers that manage units in client's area of interest and emailing the landlords directly to inquire about building partnerships. So it really starts with building trust by approaching landlords with transparency and explaining our program clearly, as well as maintaining communication and addressing concerns promptly. It's important that we tailor our approach based on the landlord's property size as well as their primary concerns. So for example, some landlords may need more of like a personal rapport, and others may prioritize financial incentives and stability. So we tailor our approach depending on that. And in addition, we utilize affordable and accessible housing registries such as the Los Angeles Housing Department Registry, which is a platform that is designed to help individuals find housing that is affordable and meets their accessibility needs. So for example, a client may need to have a place where they could have a roll-in shower or lowered sinks. They may need widened doorways, or if they have a visual impairment, they may need a flashlight attached to the doorbell, or any other necessary modifications for the individual's housing needs. We make all of these considerations when assisting a client locate a unit. And as well, we stay informed on when property managers are accepting pre-applications for waitlists that open up, and then inform the consumer or the client as soon as we receive this information. So it's important for us to do our best to hear and understand where individuals are coming from. We do this to emphasize that our clients are the ones really that are their first and foremost, they are their own advocate. So we will always provide them with options and alternatives, and so that we are we make sure that we listen to what their priorities are and what their needs are. And so these are a few things that we consider when engaging with landlords and canvassing for housing. So thank you for your time.
Thank you, Megan. And we're very fortunate to have Megan. She, during the COVID period, she was very much involved with Project Room Key. And this was at a time when landlords were not taking new applicants or seeing people. So through the Project Room Key, she was getting people into motels and then helping them with bridge housing and transitional housing and permanent housing. And Megan also is very much involved with our CalAIMS program as well for people who are high utilizers entering hospitals or HMOs and need assistance with housing services. So with that, I'm going to talk about our housing, our nursing home transition and diversion services that we provide at CalLife. So transitional and diversion services are one of the core services that all independent living centers provide, and it's driven by the Olmstead Act of 1999. So I'm just going to give a very brief definition of the Olmstead Act. So Olmstead is a U.S. Supreme Court decision that says it is unlawful to make people with disabilities to live in facilities. Olmstead says that you can get the help you need for your disability in a community of your choice. You have the right to live and work in a community just like people without disabilities. So based on that decision, CalLife works with individuals transitioning from licensed skilled nursing facilities, state hospitals for the mentally ill, developmental centers, rehabilitation hospitals, group homes, and acute care hospitals. We do this by assessing their needs and developing a plan that works for the consumer. When creating a transitional plan, consumers know best their needs and work towards a successful transition. When a consumer transitions out of a facility, ongoing support is essential. And that's what we do at CalLife. We provide wraparound services for someone who needs the guidance that they might have to have in regards to be successfully to live on their own. And so 51% of the people that work at CalLife are people with disabilities. And again, you know, it's really consumers' choice in regards to how they choose to live, but we are here to assist if needed. We also do diversion services as well here. So diversion services are also provided to prevent consumers from entering an institution or preventing homelessness. We use all available resources that CalLife has, along with outside resources. So just a little bit how we do that. There is funding that's available through the Department of Rehabilitation. We use funding through our 7B, which can help an individual, and this has to be approved from the Department of Rehabilitation. It's an application process. And an individual could get up to $4,500. If they don't get the money, that money is used towards helping someone with first month's rent, a deposit, some home modification, furniture, whatever they may need to transition or to avert them from going living on the streets. We also have a community living fund, which is up to $5,000. And again, that can help someone, again, to use the resources that I just talked about. It's important that these monies are available. And sometimes, you know, these monies run out and it makes it more difficult. So we have to find other resources that are out there to help the individual to successfully transition out of a facility or divert them from ending up in being homeless. And we have other funding sources through our Christopher Reese Foundation for spinal cord injuries. And that money can be used the same as what I talked about before. So with that, I'm talking a little bit about home modifications. So home modifications are important. We have a couple of vendors that we work with. We also have a recyclable program here that we have ramps, we have durable equipment, we have grab bars, and we help with home mod. And again, that money can be used to our transition dollars or our diversion dollars to help do a home modification for someone who just need some type of, you know, they may need something to modify in the house so they don't end up in an institution or end up on the streets. So the home modification is very important for our services that we provide at our center. And then just in-home support services, IHSS, you know, that is for people who are on Medi-Cal, who need some level of support in the home to live independently. We also provide a registry list here for someone who may not be eligible for IHSS or doesn't get enough hours to successfully live at home. So we are able to connect with in-home support services. We do the application process with them, and we hopefully could get them the hours they need and help them with the evaluation tools that that's required. And then just Section 8 application and renewal, we work with HUD. We help people with Section 8 applications when they become available. We help with the renewal. Every year, someone has to go through a renewal process for their Section 8. And so we are able to assist that. We have 2 housing specialists here. And that's just because in Los Angeles, there's so many people that need housing. And that's true across the state. And, you know, we have seen that the governor of California is pouring a lot more money into housing. We work with landlords on affordable, accessible housing here. We're standalone apartments that we have connections with to help people when they get their Section 8 application or get their Section 8. Often these Section 8 vouchers that individuals get, they have to return them. We just can't find housing, or someone chooses to live in an area that we just can't, you know, there's nothing that's available. And sometimes the Section 8 vouchers are not at market rate value. And then lastly is the LA County Coordination Entry System, CES. And this is for individuals who are experiencing a lot of homelessness, are high utilizers of the system, and need ongoing, really need to be assessed by a team that are out there, and including ourselves, and to help them, you know, to find some type of housing, get them off the streets, assess their needs, you know, and put them on a priority list to hopefully find them some type of housing, either maybe some kind of bridge housing or temporary housing, then hopefully into permanent housing. So those are some of the services that we provide at CalLife. I know it's kind of short in what I'm talking about, but with that, I am going to pass it on to, who am I passing this on to? Jordan, I believe it is.
Yes. Hi, Keith.
Okay.
Thank you, Keith. I think I'm pinned. Hi, everyone. My name is Jordan Stalker. I am currently the Senior Policy Associate over at CHAPA in Massachusetts. Just a quick visual description. I am a Caucasian male, 30 years old. I have some light brown hair and a stubble. So what I wanted to talk, and I'm going to try and breeze through this here as best I can, but what I wanted to talk about is our organization, CHAPA, and the partnerships that CHAPA has been involved in with the independent living community. So if you could go to the next slide, please, that'd be great. So up until about a month ago, I actually worked as a housing projects coordinator with the ILCs, and I worked with this was a grant program that was really dedicated towards improving affordable housing search outcomes for folks with disabilities in Massachusetts, trying to build partnerships and trying to really improve these outcomes for folks in a way that was meaningful. So by virtue of this role, I was able to come into contact with CHAPA quite a bit. And now that I'm with CHAPA, you know, I recognize that the collaboration on disability-focused housing priorities are apparent. So I'm just going to kind of highlight a little bit about some of our partnerships, and then I'm just going to explain a little bit about CHAPA and what we do, and then also kind of provide information about an equivalent organization in your state so that you can look up these organizations to really build coalition and you know, create these partnerships that are going to benefit everyone. So briefly, CHAPA is the nonprofit umbrella organization for affordable housing and community development activities in Massachusetts. We really help convene public and private sectors and look to push forward affordable housing policies and programs. And we're dedicated to working collaboratively and generating equitable solutions through coalition building, committee meetings, and legislative advocacy that really brings together a big tent. And like I said earlier, there are similar organizations in other states. I actually spoke at a New Jersey SILC meeting last week or a couple weeks ago about the equivalent organizations, the housing advocacy organizations that are in each of your states. And I'm going to send along a link afterwards, but you can actually go to the National Low Income Housing Coalition's website and click on their housing needs by state. And you should be able to locate the equivalent organizations so that you can reach out and identify whether or not there's some common priorities or legislation or really any policy priorities that have been pushed or that have been prioritized to center accessibility needs and disability housing needs. So now I'll just kind of briefly go over the collaborations that CHPA and ILC have and the ILCs have collaborated on in the past. Most recently, we've partnered with the ILCs on advancing the AHVP bill. So this is a specific voucher program that is for individuals under the age of 60 with disabilities. We recently passed a huge housing bond bill that contains a number of different policy priorities. And part of this AHVP legislation was actually implemented in this bill. And this provision we're really excited about allows for the project basing of vouchers. So makes the vouchers a lot more usable and easier to attach services and connect folks to resources as opposed to using a mobile voucher and having the chance of a property owner selling the property out from under you. And then we also advocated for the Accessibility and Housing Commission. So this is a part of the housing bond bill. And this whole commission is part of a larger group of commissions, but it's really dedicated to examining the current accessibility housing landscape in Massachusetts. Shocker, similar to some other, bunch of other areas. We do have an issue when it comes to accessibility and making sure that accessible units are online. And this commission is really being tasked to study this and really develop recommendations for our plan going forward. And then the last thing I just wanted to highlight is we are, this is actually a priority that I was engaged in when I was in my previous role, but we have similar priorities in this role as well. But we sought to advance accessibility priorities in our state's qualified allocation plan. And for folks that aren't aware, this plan essentially impacts the requirements the developers need to meet if they are to receive low-income housing tax credits. So if you are able to Google QAP and include your state, look at the accessibility requirements that are in your state, and you can actually draft recommendations and send them to your local housing agency. And there is an advocacy process, there's a public hearing process, and you're more than welcome to kind of build coalition and draft your own QAP recommendations that are going to benefit folks with disabilities. Just a couple of recommendations that we really tried to implement, basically placing requirements on accessible housing, not having it be necessarily an incentive structure, but making sure that these requirements are in place. And also just making sure that these low-income units that are set aside are also being accessible as well. And then a couple of ideas for future opportunities. A few folks have really touched on it. We really want to make sure that we're narrowing the scope of these technical partnerships and making sure that we're focusing on building capacity between ILCs and other housing organizations, really making sure that we're centering the ILC perspective and the perspective on the ground of folks that are really struggling with housing and housing search. And I'm, really confident in the future of that, but we just need to make sure that going forward, we have these, these notions in mind and that we're really centering the folks that need the help the most. Thank you.
Thanks everyone for these great presentations. I think we learned a lot in hearing about your perspectives and all of the incredible work that you're doing out in the community. And with that, we have some time for questions, so we can bring back our presenters. And I'll just pull open the Q&A, and if our presenters want to come back on camera, and if we could pin them all, that would be great. So the first question is related to the percentage of CILs that provide support with home modifications, but I'm going to broaden that question a little bit and ask Mary Kate, is there data available about housing related supports provided by CILs across the country?
Yes, and there is some data that CILs have to report on housing related goals in transition. And that can be found on ACL's website through the PPR. However, I know this that specific home modification program part, no. Individual states might know. Anna, I don't know if you know specifically for California, but I would just get us talk to your local CIL to see if they do.
Yeah, this is Anna. I'll just add that, like, for example, as an example in California, some CILs leverage other dollars specifically for housing and home modifications. That might include CDBG, block grants, community development block grant funding, community CSBG funding, block grants, area agencies on aging, sometimes Older Americans Act funding, they might leverage for home mods. And then in California, you know, Keith mentioned the Community Living Fund. That was a state general fund investment for transition and diversion, where we're seeing a lot of utilization of that for home mods, other housing support services. And then the state plan for independent living in California does have funding specific for transition and diversion. And again, that's also for homeless transition and diversion. And those dollars, the Rehab Act Title 7B dollars, are used in California for some of those home mod and other housing supportive services. So those are just some examples.
Thank you both. Here's a great question. What strategies have you used to enable client data sharing between homeless service providers, COCs, and CILs? And COCs are continuums of care, which are entities that are responsible at the local level for helping to address homelessness and manage coordinated entry systems and homeless management information systems. So who would like to kind of hop in on that question?
Keith or Anna.
Yeah, I can just start by saying that. So it's a really good question, and one that I'll just start by saying that I would love to see the data, because CILs do so much around housing and homelessness. I would love to see their data reflected in the homeless management information system, right? But I don't think largely it is. California is an example. I think I have about 5 centers for independent living that are getting homeless specific dollars and have the agreements to enter data into the homeless management information system. So how do we get more CILs putting their data in there so it's reflected? I think is key. I also think that, you know, I have not seen a lot with data exchanges that would, you know, make it easy for a CIL to basically take the data they're already collecting and upload it into those systems so it's reflected. I think that's an area I would love to see all the CILs be able to be reflected in that work.
I'll just add to that real quick. Being in downtown LA, we're right next to Skid Row here. And I've seen things that no one should ever see down here. And these are, we see a huge fentanyl problem down here and a lot of meth and a lot of people with physical disabilities and wheelchairs, you know, and I guess if you're on the street and you're self-medicating it, you know, that's one way to sort of, you know, deal with reality. But we do a lot of work with individuals who have psychiatric disabilities and homelessness, and it's a shift for ILCs, right? I mean, it's a, you know, we're used to working with people with, you know, we're across disability, so we don't turn down anyone. But a lot of individuals come into our center right now who are homeless and have substance abuse problems.
One partnership that I wanted to kind of I wanted to discuss briefly. So it's not exactly the same thing, but it's in the same ballpark in terms of data gathering. when I was working with the ILCs and the SILC, we actually partnered with an organization called the Housing Navigator in Massachusetts. And this is basically like Zillow for affordable housing search. And it's a really, really great resource. And they actually have the capacity to develop a report for us to identify the accessible and affordable units that are currently in each independent living center's area. So we can use this data going forward in our spill planning and just tracking in general. So if you do have any accessible and affordable housing search registries in your states, I would highly recommend getting in touch with them and just looking to build partnerships that way as well, because a lot of the time they have those connections with the developer community and the folks that are actually building the housing. So yeah, just a plug there and encouragement to reach out to those folks if you're able.
Thank you all. Well, we have 3 minutes left. So I want to thank Mary Kate, Keith, Megan, Anna, and Jordan for your presentations and participating in this question and answer. I think you give folks a lot of really great ideas and strategies that they can take back to their own communities. And with that, can we bring up the slides? And also, through all the questions and the engagement in the chat, sounds like we need more opportunities for webinars on this topic, which we would be very happy to continue to share stories and ideas out with you. So some key takeaways from today, that there are Medicaid flexibilities that are increasing available funding for housing related supports and services. Centers for Independent Living provide housing and other community living supports to people with disabilities and other populations. And people with disabilities, Centers for Independent Living statewide independent living councils are key partners in advancing community living and accessible and affordable housing solutions. And if you're not currently connected for your local Center for Independent Living or statewide independent living council, we encourage you to reach out and start a conversation. Next slide, please. You can find a wealth of resources on partnerships in housing, health, and social care, and lessons learned and best practices through the Housing Services Resource Center website. Just use the QR code navigated or located here on the screen. You also see a screenshot of the homepage of the Housing Services Resource Center. Next slide, please. Here you'll see an infographic that shows the many different services offered through the Housing Services Resource Center through in circles, surrounded by circles. On the HSRC website, you can watch recordings of webinars that feature these multi-sector partnerships. Our tools section provides easy access to directories to find housing partners, get data, and find housing and services partnership models and discover a variety of toolkits. And the focus area section on the website is a great place to learn more about accessible, affordable housing. And our What's New page is a great way to find out about upcoming events and webinars. Next slide. And we're always looking to improve, so please complete our short feedback form. We'll drop a link in the chat for you to be able to see that. You can see the QR code to be able to access it as well. And the link will be provided in the slides that will be available after today's presentation. And next slide, which is our last slide, we want you to know that the Housing Services Resource Center is here to help you. So please email us at hsrc@acl.hhs.gov. We want to learn about your partnerships and innovations. Let us know if you have technical assistance needs. And also please subscribe to the HSRC listserv, which is 20,000 individuals and growing, and also visit the website. And with that, we want to thank everyone for attending today's webinar, and we look forward to having you at future events. Thanks, everyone.